and discussed about atrial fibrillation in our previous video, and to re-emphasize it, it is nothing but an irregular and often a very rapid heart rhythm that can lead to blood clots in the heart. Now, AFib, it increases the risk of stroke, heart failure and other heart-related complications. This condition may have no symptoms per se, but when symptoms do appear, they include palpitations, the shortness of breath and even fatigue. Appropriate regimens of anti-thrombotic therapy for patients with atrial fibrillation and coronary artery disease have not yet been established. So let's discuss more about it. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to talk about a post hoc secondary analysis of the AFIRE trial. A question asked here is rivaroxaban monotherapy associated with a lower incidence of total cardiovascular or bleeding events than the combination anticoagulant and antiplatelet therapy in patients with atrial fibrillation and a stable coronary artery disease? Now, this was the question which a recent JAMA study aimed to find answers to. This was a post hoc secondary analysis of the atrial fibrillation and ischemic events with rivaroxaban in patients with stable coronary artery disease, which is abbreviated as the AFIRE open-label randomized clinical trial. This multi-center analysis, it included patients with atrial fibrillation and also stable coronary artery disease who had previously undergone a PCI procedure, that is percutaneous coronary intervention, or a coronary artery bypass grafting earlier. Now, in this post hoc secondary analysis AFIRE trial, a total of close to 2,215 participants were included. The results of the study showed that rivaroxaban monotherapy was associated with a 38% lower risk of total cardiovascular and bleeding events, which remained statistically significant. The mortality risk after a bleeding event was much higher than after a thrombotic event. This meant that rivaroxaban monotherapy was associated with lower risks of total thrombotic and bleeding events in patients with atrial fibrillation and those with stable coronary artery disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.